Hey y'all, welcome to starting with today's Jumpstart Your Health Week. It is time to go. It's a great week to get really excited about your health, but also our community and our community's health, our community's freedom. We are excited to have you. Thanks in partnership to Adventist Healthcare, who has been amazing. Also, for Saturday, we have Howard University Hospitals on staff. We have Prince George's County Department of Health. We have Lee's Barbershop. Of course, we had to bring them, Prince George's County Department of Health. But tonight, we're starting with Hip Hop and Health with Dr. T. Newsome and Dr. Ogechi. So we are excited to bring them on. Thank y'all for coming, and we'll get started soon. Let's see. Right. Thank you all so much for joining us. Hey, hey, hey. Hey, hey, hey. Hey, how are you?
Hey, good evening.
Good evening. Thank you so much for joining us. We're going to give Dr. Newsome a few minutes. He was calling as we were. He was like, I don't see the live. I said, because,
I know me too.
I'm on the phone with you. Oh, goodness. How is your Monday going? You look gorgeous.
Thank you so much. You do as well.
A
It's
little
going pretty well.
refreshing.
I can't complain. I can't complain. How about you?
I'm doing great. I'm doing great. Thanks so much for joining us. And I'll just get started on some of the background. One of the reasons we decided to have this discussion when we first talked to Adventist Healthcare. They've been a partner since the beginning of this year, which has been amazing. So shout out to Taryn. She's amazing. But we had what I thought would be a small conversation around how can we integrate some of health into our community and make it relatable, and how can we reduce some of these barriers to access, right? And to make it culturally centered. I think what we saw nationwide after this pandemic is all the health inequities we've been talking about for a long time. This is not new. But we saw it at an enormous cost at our community, right? I know I've lost so many friends that were younger than 40. Black, younger than 40, due to pre-existing, health conditions. And so I wanted to see what we can do to really get the information out. And so starting with today, just give a brief overview as a nonprofit. And we're really about Black healing and Black liberation. And we do that under a facet of a lot of different programs around mental health, economic empowerment, and career services, and also well-being. And one of the things we began to pick up in the barbershop, at Lee's Barbershop in Southeast DC, is really the work around how can we begin to get this mind, body, and soul connection. And so we've done work around grief and emotional wellness. And then we begin to ask for like fitness and how do we get some health connections as well. And so that has been our bridge until we did the hair appointment where we talked about Black maternal health. So this is a continuation of that work. And so we're so excited to have you here. Let me double check and see if I don't see him yet, if Dr. Newsome have joined us. So that is the overview of how we got to this, landed to this space. And I really wanted it to center hip hop and health. But before we do that, I want you to please introduce yourself, tell the people about yourself, and tell us why you got into medicine.
Yeah, so my name is Ogechi Anyaoku. I am a primary care doctor in the Fort Washington area with Adventist Healthcare. I have been in the DC area, DMV area, for quite some time. I did a master's in public health at George Washington, and then went on to do medical school at George Washington as well, and then my residency training at Washington Hospital Center, the Georgetown program in internal.
Wow.
So
That's impressive. I haven't seen too many of the public health 2MD,
Yeah. So it was kind of a route to the MD, just because population health sometimes is missed in kind of the individual care. We don't really think about population health as much as we do person to person, which both are extremely important, because we all live in community. So the population part of things is key, as well as trying to affect change with each individual patient as well. So I wanted something where I could marry the two and kind of bring the most benefit that I could to the community around me.
I love that. I love that. And thanks so much for your journey and how you got here. One of the things we talked about was when we first met was about, like your holistic approach to medicine. Can you speak about that a little bit more? And I think to what you said about, population health and how it begins to really affect our communities, what we've saw over the last 12 months, 15 months or so.
Yeah, so my philosophy in medicine has always been the same. It is the whole person. You have to treat the whole person. And from when I was applying to medical school from the very beginning, that has always been my personal testimony, that each individual, you have to be able to tap into all the different aspects in their life in order for them to truly be healthy. So it's not just about I'm treating the numbers when it comes to diabetes or high blood pressure, things like that. It really is about what is going on in your life and your family. What is going on with you spiritually? What is going on with you mentally? What is going on with you as a physical portion of things in terms of movement? Can you move? Can you walk? Can you do all of these things that are sometimes we take for granted, which are very basic, but sometimes it can be very difficult for some people. So it really is a whole person approach that you have to take in order to really be of a benefit to anybody.
And I began to see that shift over the last maybe 5 years in my primary care physician visits, right? Where, in addition to how I'm feeling physically, one of the questions that come up is what's my stress level on the scale from 1 to 10? She asked, and that's not until I got a Black woman. I'm not sure if that's a shift in the industry or a shift because she's a Black woman. But that's one of the things I had never really thought about. And, how am I sleeping? Is a question that comes up now every physical. And so those are things that I believe begin to kind of get to some underlying causes and conversations. And I believe is a great shift to the full body that, primary care physicians, need to begin to service, especially in our community.
Absolutely.
So let's talk a little bit about why hip hop in health. And for one, I want to center the hip hop generation, which is typically Black millennials in America. We're raised on hip hop. We love hip hop. And so, and I see Dr. Newsome, so I'm going to bring him on while we're getting, okay. Dr. Newsome, I just sent you a request. Yes.
Yay.
I got it.
Yay. Thanks so much for joining.
Hey.
How's it going?
Have y'all met? Y'all both work for Ventus, but y'all in 2 different counties.
We have met.
We have. Very randomly.
Good stuff. Well, thank you both for seeing the topic and being interested and saying, hey, this is something that I want to invest some time and energy in. The cause of meeting you all was just so much love and so much alignment. I'm excited about this. So, turn your camera back. Oh, there you go.
Sorry. I'm trying to get this together.
No, take your time. So, why hip hop in health? One of the things, of course, I was talking about is we're the hip hop generation. So Black millennials are typically born in the late 70s through the 90s, have been raised in this hip hop culture. We have defined, not only hip hop culture, but American culture. And one of the things that I love about hip hop are a few things, right? One is how quick messaging gets out, right? It is a huge vehicle to get messaging out to our community. So when I think about one of the most influential moments, I remember there's a song with JD and Jay-Z talking about money ain't anything, and they were talking about private jets and things I hadn't even thought about or seen before. And I was like, wow, that's a lot of money. And then, we saw with 444, he began talking about credit and art collecting. And so you see this huge wave of Black people getting into art collection now and trying to become, more financially stable and sound in their investments. So I think there's a huge shift. There's a huge influence that hip hop has on our culture. And I just want to get your feedback, just, informally, about how do you feel that hip hop influences culture? And, if you had any thoughts about music or favorite songs or things that get you moving.
Ladies first, go ahead.
Absolutely, it does influence our culture. Not necessarily even hip hop in and of itself, but music in general, because music tells stories, music gives information, music is an outlet for people. So any way that people are getting information with a wide stream like that, because if you're listening on the radio station, if you're listening, streaming it from somewhere, music has the ability to touch so many different people in so many different areas that it is very important that the things that we're saying in our music, have an impact on the way that we're living our lives. So we can actually affect change just with music that, we're listening to and enjoying, not knowing that it is having an impact on the way we think sometimes, on the way that we make our decisions and the things that we do. So absolutely.
Absolutely. I definitely agree with that. And I have some follow-up. I'll let you go, Dr. Newsome.
Yeah, I mean, I definitely agree with what she's saying. I think music is so influential in ways that we don't even necessarily recognize sometimes. I can't think of any specific songs per se that talk about like too many like health related things, not because they don't exist, but just because I can't think of any off the top of my head. But, I think that it affects the culture overall. I think that if more rappers or even R&B artists like rapped about how amazing it was to be a professional or go into different careers that are deemed positive and things of that nature, like you'd be surprised at how many little kids especially are like, oh no, Lil Wayne said doesn't X, Y, and Z or whatever. And so I just think that it's very powerful and it's very interesting. We can even look at how many like young kids know various dances and things of that nature just because of what they see on TV or what the rappers are rapping about and stuff like that. So it's just super, super influential, especially in the minority community. And we can't take that for granted, when artists like Beyonce or somebody, co-signs something. It's like, it's monumental. Like everybody's like, oh yeah, well, Beyonce said it, so therefore it must be fact. So, it's kind of scary, but also very admirable, and we just have to take heed to that is a thing and be very mindful of that.
Yeah.
Right.
Go ahead.
And I was just saying in that it can be used as a platform for so much good, because unfortunately, one thing that is real in minority communities is drug abuse, addiction, and such things. So, it is rapped about, and unfortunately, we're not seeing some of the things where it can be improved when we're, listening to the rap music. So trying to maybe shift into how we can make music a little bit more beneficial when it comes to certain things like that, would really be something like Dr. Newsome said. Yeah, it can affect a small child, and then perhaps listening to that music that's more positive, they don't go down that path. So yeah, it's, very influential.
Absolutely. I agree. And so I have a couple thoughts, right? One, for you, what you were saying about, definitely the mental health part that you see. And we saw with DMX, he talked about it with slipping and addiction. He struggled with addiction. He's very open about his struggles with addiction. And I think that's really something that we kind of gloss over until it's a tragic loss, right? On the more positive side, I think one of the things we may miss about hip hop music and music in general is how it gets us moving. I'm not sure why my screen is going dark. Can I see me or hear me?
Yeah.
Okay, great. One of the things I think about is how it gets us moving. I know when I have intense deadlines that I need to, power through all night, that, I'm definitely going to hip hop versus, some classical, some R&B, so I won't fall asleep, right? So that's when I'm running, I typically lean hip hop or a Caribbean or something that has a good beat and tempo so I can run. But also culturally, I think, and I was talking to a friend about the event that we're having Saturday, and I was like, I just cannot wait to get back and wobble, do the wobble with my friends. And I was just thinking about how much movement that is and how much excitement it is around line dancing, from the electric slide, to swag surfing, all this movement that our music incites. And I think when we talk about hip hop, there's always this kind of negative stereotype on it. But when I'm thinking about Black people in fitness, we'll go to the club and dance. We might not go to the gym as much, but we will, find a place and opportunity to get some dance in. And if that is intersections that we can begin to highlight and be more mindful about, and then especially talking about health. And I think one of my goals is to say, hey, we have said that money is everything in the hip hop generation. Well, what about health? And how can we begin to really leverage the power that we have right now to create healthier selves for ourselves? I know personally, my dad was in 2019 diagnosed with cancer, and he's fine now. And but it was like a wake up call. Like, now I need to, I need to get pre-screening for breast cancer. I'm not of age, like all these things I need to begin to talk about now with my physician has shifted from, I'll wait from the timelines, to no, this is something that we have to begin to start managing now. So that brings me to one of the things we talk about as let's say someone hasn't been to the doctor in 5 years, right, or more, because there's access issues that we know, there's cost issues, but there's also trust issues. So what would you say to someone who needs to go to the doctor and hasn't been, and they're overdue?
I would probably say, I think for the most part, most of us have some sort of smart device. I think the first thing I would probably do is do a quick search of the providers that are in my area. And I would look at their information. I would look at their pictures, see somebody that I would feel like I would be comfortable with, look at what their philosophy on medicine is, and then start from there. Also, just starting from the people around me, my friends and family, if they have somebody that they go to, if they're comfortable with or that they trust, I think that's probably a good starting place.
I agree. And you said something really good it was really recent, right? Because I don't think even 10 years ago, there were many doctors that you can Google and see their picture or their website, or, how they do medicine, or how they treat medicine, or if they have a, Instagram page. I think this is a very new shift that we're having. And I know that's my approach I take with my medical physicians and mental health, right? And it's just someone I feel like that it would be alignment with. How about you, Dr. Newsome?
I definitely echo some of the sentiments that she had. Find somebody that you're comfortable with, and just be mindful that just because you go and see one doctor doesn't mean that has to be your doctor moving forward. Sometimes even just getting that initial visit where you get some blood work done, honestly, if you don't have a good visit with that particular physician or provider, you can utilize that visit itself and just, like I said, get the lab work done and then take that to the next provider thereafter and just say, hey, I have patients do this with me all the time. I went and saw another doctor, didn't really, get along or get a good vibe from them. I do have my blood work. I was wondering if we could go over it. That's a perfect step up, or step off in terms of like that, building that relationship with the new doctor. And just knowing that it's not set in stone. You don't have to see somebody that you, A, don't connect with, or B, don't even get along with. I think that's really, really important. And it helps, it helps when you look at like, not necessarily health disparities, but just like progression of health. When you have a good relationship, especially with your primary care doctor or your doctor in general, patients typically benefit from that. They're usually healthier. You're more likely to follow what the doctor is asking you to do. You're more knowledgeable about your health because you feel confident and asking the necessary questions, so that way you can feel comfortable with what you're doing, whether it's taking medication, whether it's dieting or exercising, or even getting vaccinated on certain things. So just knowing that in the back of your mind, like this isn't a lifetime commitment. I'm going to see this one doctor and I have to stay with this person. It has to be the most amazing decision that I've ever made. Exactly. No, it's not like that. Like, take some of the pressure off. It's okay. Go there, get what you need, and then, move on if necessary. If you like them, then continue. And, just taking that first leap of faith is really important.
So you saying you can date around until you find a doctor?
Pretty much, yes.
Absolutely.
You can definitely date around.
I love that. And, I think that's the same messaging that, we definitely have touched on before with mental health providers, right? A lot of times people offer a consultation for 15 minutes over the phone for free. Like, take up on that. And I think one of the things you spoke about that is very innate in our community is vibes, right? Like, do you feel comfortable? Do you trust that? What is your gut saying? And I take that now, right? I take ownership of that now. But initially I felt like, oh, I just have to go with whoever this doctor in my network is. And that is not, the case. I've one of my cases, and it's not sad, so don't brace yourself. But I had a stillbirth, and one of the things I had advocated the entire pregnancy that I was not feeling good. I was sick the whole time. It's morning sickness. It's month 6. I'm still sick. It's just morning sickness. You'll be fine. And I wasn't fine. And no additional tests were taken. Nothing, was done until till afterwards. And so then I was like, okay, I need someone who will listen to me. And I also need to learn how to advocate for myself. And I didn't know what that looked like or felt like at 26, that I would have known now. And that's another thing that, I think maybe we can touch on what rights do the patient have in their healthcare. Because I think a lot of times people walk into the doctors feeling like it's what they say or else, what I'm saying? It's a one-way street. It's a dictatorship. And I think that, from what I thought it brought a lot of fear and anxiety to me when I thought about going to the doctor's office.
For sure. I mean, I think it's really challenging. I think sometimes people have traumatic events with the doctor's office, whether it was a bad experience with a loved one in the hospital or even a bad experience, with their primary care doctor along the way, or even missing something like you kind of touched on. And it can scar individuals, especially minorities, because as we know, there's not a lot of minorities in healthcare.
Yeah.
So seeing people that look like you is often unheard of, unfortunately, even today.
Yeah.
So, advocating for yourself is really, really important. I think that it's so important, but also you don't want to get in the way of your healthcare either. I sometimes have patients that are so, what's the word? Like they're so damaged, for lack of a better word, from previous healthcare providers that they often make their own barriers in receiving good healthcare. But I think there's no such thing as a dumb question. I think that you definitely have to advocate for yourself and come in with questions. Sometimes it's easier to write them down. Like, let's say, for instance, that your doctor starts you on a medication, and this happens all the time. I'm sure everybody can relate, but do you think that such and such side effect must be from the medication? Write it down. Say, hey, I noticed, I was having this. Could this be a side effect? And then just posing that question at your next visit and whatnot. So that can go a long way, because oftentimes you get anxious during the visit, whether you've seen the doctor for the first time or even the second and third time. And you get anxious and you're like, oh my gosh, like the doctor's in here. I just got my blood pressure taken. Like, what's going to happen next? And you forget everything that you were thinking of the weeks before. So just write it down. Bring out a little, and again, within reason, it doesn't have to be 100 questions per se, but just like, a couple things that you're really curious about or concerned about. Those are great times to discuss those things with your doctor, and your doctor should pose that platform for you to do that. That should always be the case in any visit. Hey, what, are you having any concerns? What other questions do you have? Those are things that us as physicians or providers should be asking our patients, not just obviously our minority patients, but just in general. And if you're not getting that type of feeling, then you might need to find a new provider, if you're not feeling comfortable being able to pose such questions and to be able to advocate for yourself.
I love that. Take notes. I think, one of the things that I've begun to do too is kind of keep like a little note on my phone. So if I'm feeling some type of way, or if I'm feeling a little unsure about something, so I know for my next, like a little journal for my health as well. How about you, Dr.?
Yeah, absolutely. I absolutely echo everything. And then also, when you are going to see a new provider or establishing a relationship, take some time to think about the things that are important to you in terms of your health. What are your goals? What do you want? What do you want out of the relationship between you and your provider? You want it to be a mutually respectful relationship. You want to be able to be open with your provider, and also your provider provide information for you that is honest and not biased either way, not just to please you and not also just to push an agenda. You want them to be able to state the facts, but also to be able to, and if you want their opinion, what their opinion would be. Because a lot of times you know, you want to treat that patient not just like they're a patient, but also sometimes like a family member. Like, if this was my sister, what would I do? What would I want for them? If this was my
Yeah.
mother, what would I do? So you have to kind of go into, as a provider, go into each patient, um, thinking about them as what is the best thing that I could do for them? Thinking about them as if they were somebody that was so close to me. Would I want this for them? And as a provider, knowing like the statistics and the facts and things like that, also bringing that into play. But absolutely, I think it is so important to make sure you write down what your goals are, because you know the hope is that you will have that relationship with your provider for a long period of time. So you
Yeah.
want to make sure you're fostering something that's very healthy.
I love that. And so we had a couple questions from the audience, and if I do see some in the thread, but if you have questions as we're going along, please use the question mark Q&A, and we can answer those towards the end. But someone said, what about having the fear of being labeled as a difficult patient? How would you approach that situation? And I feel like, I think one of the things I fear, and not just have feared in the workplace and in certain situations as a woman, as a Black woman, we're trying to be not, all these labels that are
That
sometimes
stereotype, right?
right affixed to us. But at the same time, now it's like, this is life or death. This is, how do we come into that situation, not being fearful, but also making sure that we're advocating for ourselves.
Yeah, that one is tough because when you're going into that, you're obviously going in with something that has happened before, or you've experienced something, somebody's told you that they had an experience. But I would encourage everybody to go into every situation trying to have as open of a mind as they can. And then, because as providers also, we are trained to try to be open and unbiased, although we're human beings, everybody has their biases. But as much as you want us to give you the benefit of the doubt, we also want the benefit of the doubt of saying that we're going in with an open mind and we're going to treat you equally as we would treat anybody else. Because really, there should be no stereotypes, because at the end of the day, our goals are the same. We want you to be as healthy as possible.
I love that. I love that. And I love what you talk about, getting clear on your goals and what you want out of this, um, you know, doctor-patient relationship. And one of the notes in the comments from Michelle says, I love that it is still a relationship, even if it's not familiar, right? It's a relationship, and we always don't think about it that way. And I think that is beautiful. I definitely feel like it's taken a long time to get 30 plus years to get to a place where I feel like my medical health care providers care about my being as a person, as an individual, that they want to see me well, and they also wanted to see me succeed. And we had talked about this a little bit, Dr. Newsome, before you got on, but one of the things that I was one visit I went in, and this kind of things you're talking too about having continued healthcare, Dr. Ogechi, was that I went to one of my doctor visits and my blood pressure was higher than normal, like sky high. And so she was like, what is going on? Like, what are you eating? What are you sleeping? And so she's like, no, what's going on with your life? And I was like, oh, I just moved. I just got out of a relationship. I just got a new job. She's like, oh, you're going through too much. So, like, you need to pause and but had there not been this history of what, my normal health, my normal stats are, then despite it might have been just glossed over as it's just food versus there's a lot of changes happening with you that's causing this spike. And how do we continue to monitor it? So we monitored, I think, over the next 3 to 6 months until there were normal a steady normal numbers, which I wouldn't have, instead of just saying, oh, you need to get on medicine,
Absolutely. I think those are some of it's challenging, right? Like we went to medical school, and did medical training. And so we've seen a lot of the ins and outs, from obviously the medical professional standpoint, but we were patients at one point too, and some, often still are as physicians. And so, I think one of the benefits being a minority, and not to say that other ethnicities don't necessarily experience this or even understand this, but I try to look at all situations like, wow, like, okay, when I was a patient, this is what I would have wanted from my
Mm,
doctor. You know, and you want to feel that. And I'm going to be honest. I mean, I don't think that every single patient necessarily gets that vibe from me, if you will. I think that I try to do that, but I think that there's some times where there's just a disconnect, whether it's cultural thing or if it's you know, maybe it's just that day thing. We've all been in situations where we're just running so behind and the patient's not being reasonable and they're trying to keep you in the room for an hour and you only have 20, you know, and it's just a very impossible situation,
we
unfortunately.
want a whole hour.
Everybody wants an hour and no, you know, there's no hours to give. But you know, and it happens. But I will say, as it pertains to being a difficult patient, I honestly have had some patients on our first encounter, and I'm sure, you know, other providers can attest to this. Our first encounter was rough. It was rough for them. It
Mm.
was rough for me. It was challenging, you know, and fortunately we're trained to deal with challenging situations on a regular basis. But the visits thereafter, after we got through that barrier and, you know, the trust was established, you know, those after visits became so therapeutic for both of us. And it was like, wow, look how far we've come. So yeah, it can be kind of daunting and scary to be like, oh man, like I don't want to ask too many questions or I don't want to object too often with the doctor, what the doctor wants to say or do. But that's honestly a part of the relationship. You know, you're going to disagree with what we want to do sometimes, we as providers. You should, you know, you should question things within reason. And, you know, if you don't want to do something, I tell my patients all the time, if something happens and you don't want to do something, by all means, you have to let me know. Just don't surprise me when you come back in a month later or 2 months later and be like, yeah, I stopped doing that 2 weeks in. And it's like, well,
I'm
that's
like,
not, you know,
no,
like
thank
that.
you.
That makes things just challenging, and it happens, right? But like, nonetheless, like I want it to be an open dialogue. You know, call me, send me a message if necessary. Like I want to know what's going on, just like in any relationship. If you have concerns, you know, speak on them, say it, and just, you know, and don't necessarily worry about being difficult. And again, it's a good way to kind of test your provider too. Like, is this the person that you feel comfortable with? Is this a person that's going to give you a hard time every time you say no, or are they going to be the one that educates you and say, hey, like, I understand your concern, but this is really what you need to be worried about. And let's take some time to think about it. Like your doctor mentioned to you with your blood pressure, let's take a couple months and see how things go in terms of your stress levels. And those are the providers, you know, because all providers aren't created equally, right? Like, you know, we are human too. We have biases, like we've talked about a little bit. And it's just finding the one that kind of connects with you on some level. You know, it's not going to be every level. We're all human, but some level where there's a connection.
I love that. And so let's talk about, health checks. I know annual physicals is kind of the given, what we know has to happen. But if let's say someone has a lot of questions or concerns, is it possible that they can say, hey, we need more? Can they advocate for more visits for themselves, or what does that look like? What's the first step you feel like is getting
Excuse me.
a health plan, a health strategy in place?
Um, I think I have patients who ask often, like, you know, I heard about this screen, like, and a big one as of late is like colon cancer screening, especially for like minority men, especially younger men. It's, you know, everybody's pushing to get a colonoscopy, and you know, just I think asking the question to say, hey, doctor, whoever, I'm wanting to get the screenings that are necessary. You know, can you talk to me a little bit about those? And you know, your provider should be able to kind of list off. You know, when you're younger, typically you don't have quite as many screenings, but as you get older, those screenings kind of start to pop in like around age 45 and sometimes earlier, depending on the situation. But I think just asking the questions of things that you're concerned, or even leaving it open-ended. Hey, I'm concerned about screenings, or you know, what things I need to be doing and how often I need to be doing them, whether it's labs or anything like that, or imaging. You know, what does that look like? What should I be expecting? Those type of questions are encouraged.
I love that. And one of the things I know that devastated me in the midst of everything else was losing Chadwick Boseman last year to colon cancer, right? And I
Mhm.
know it took the world by storm. And I think for me too, when we saw he had from what we know is having, what we assume is having, access to probably the best healthcare, providers in the world, but still, was not able to, um, uh, you know, necessarily win that battle on this side of the plane. But I think what it did activate, on the flip side, in a bittersweet way, was that, you know, we saw younger Black men beginning to ask questions and go to the doctor, not necessarily write off my stomach hurts or my back hurts, as much as, you know, I feel like we've seen that in the past. So I think there is a benefit of saying, hey, let's talk about colon cancer, let's talk about prostate cancer. So let me talk a little bit about in answering when people should take those tests for screenings. So you both can answer that, but also, what questions should people be asking? What family history should you know when you're going into the doctor's office that may precipitate what screenings you need to begin to take, if that makes sense?
Yeah, so I mean, you definitely want to know about any cancer history in an immediate relative. So that means like mom, dad, and siblings, because those are the ones that are going to put you at higher risk for anything. So that really is any sort of, and especially like you said, as we're seeing things like, you know, the colorectal cancers and things like that. But obviously, breast cancers, prostate cancers, you know, cervical cancer. Well, cervical cancer is more so. It's a little bit different than the rest. But um, you know, you want to make sure you know all of those cancer screenings. You want to know about a family history of high blood pressure, diabetes, high cholesterol, all of these very common, what I call lifestyle diseases. Even though a lot of it is impacted by your lifestyle, the family history does also have a significant impact too, because, you know, kind of based on what you do, how you live your life, you can kind of push yourself into developing that disease a little bit more than if you were to maybe take a little bit better care of yourself or live a different lifestyle. So you definitely want to know about really any major disease that is in an immediate relative.
I love that. And I know it may seem obvious, but we just want to define lifestyle disease just to make it plain for
Yeah,
anyone.
so I'm glad you asked that, because that is, you know, one of my passion is lifestyle medicine. So that is
Mm.
anything that you do in your day-to-day life that can affect whether or not you express a certain disease. So it's exercise. Are you exercising regularly? So that will impact whether you develop diabetes or high blood pressure.
Mm.
What you're eating. Are you eating your fruits and vegetables every day? That's going to also impact whether or not you develop diabetes. Are you eating more of like a plant-based diet? That can affect your, you know, development of high blood pressure. Sleep has such a huge impact on high blood pressure, weight gain, all of those things. Stress levels, we talked about that a little bit as well. So anything that has to do with your daily life, your lifestyle, so how you're living, can impact whether or not you develop a disease.
I love that. And I think a lot of times we think about genetic traits, as, you know, the primary thing, you know, that's passed from one generation to the next. But lifestyle is also was passed on from one generation to the next. It's really why we want to have this conversation this week as well. It's to highlight, you know, hey, we know we honor everybody that came before us who did what they could and what they knew best to survive. But now we have a little bit more information, a little bit more access. How can we say, you know, we want to live a bit healthier, but we also want to raise the next generation to be healthier and to be stronger as well, so we're not fighting these same, you know, diseases, you know, in the same magnitude, you know, in 15 and 20 years down the road. How about you, Dr.
Absolutely.
Newsome?
Yeah, I definitely echo those sentiments as well. High blood pressure, diabetes, high cholesterol is another big one that is really important to know which individuals in your family have had issues with those things in the past or even in the present. I usually like to ask about like cardiac related illnesses, like heart related illnesses. If patients had heart attacks at young ages, that's good to know because that can kind of change the amount of screening and or the threshold for treatment as well, which can be a little bit more challenging. Sudden cardiac death is another big one that can sometimes be helpful, especially for our younger patients. I also like to talk about like mental health too. So like if there's like bipolar disorder in the family or schizophrenia, because there are genetic components that increase the likelihood of, immediate family members, whether it's your, patient's, if a patient's parent or aunt or even sibling have any of those like psychiatric illnesses, it increases their chances for possibly developing those sometime in life. So those are really good to just kind of break the ice and just kind of make people feel comfortable with their psychiatric or psychological health as well. But all of those things with the lifestyle diseases, if you will, are very, very important to know, especially as it pertains to your family members.
Do y'all have any tips per se, if, to have those conversations? Some families are very open about their health issues, and, what your parents are dealing with and what medications they're on, or, your family members. And then some families are very, secretive about that. How do you have any tips around how to begin to have that conversation with your family members about, knowing what their health history is and how that begins to affect your own health history?
I would say maybe just pose it as you want to get healthier. So like if you want to talk to your mom or your dad about what your family history is, say, Mom, Dad, I'm trying to take control over my health. I want to make sure that I'm here, and I live a long life for my kids, your grandkids, so that, I can just live the best possible life. Is there anything in our family that I need to know about so that I can tell my doctor that might, change, my health management? I think, starting it as a conversation about you wanting to make yourself better and healthier is a good way.
I agree. Love that.
Yeah, I like that too. That's a good one. That's a good one.
Okay. Well, great. Did you have anything else to add to that one, Dr. Newsome, by chance?
No, I think she hit it right spot on. So I like that. Yeah.
So what doctors do y'all feel? Of course, you both are primary care physicians, correct?
Mm-hmm.
Correct.
Do you feel there are any other doctors that need to be in a health ecosystem for a patient? So I know as a woman that I need to have an OBGYN as well. Are there any other doctors or types of doctors that you feel should be in a person's health ecosystem to have optimal health?
I think for women, having a gynecologist can be really, really helpful. A lot of times women at younger ages only seeing their OBGYN up until a certain age, where they're needing a little bit more strenuous screening and testing and things of that nature that their OBGYN probably isn't going to be as comfortable with. But I mean, I think it depends. I think it depends on what type of conditions you're undergoing or going through. And, it usually starts with your primary care doctor for them to, and depending on your primary care doctor, it depends on what type of specialist you're going to need to see thereafter. I don't think every patient with high blood pressure needs to have a cardiologist. I don't think every patient with diabetes needs an endocrinologist. That's just not the case. Some patients do think that. They think that, that's necessary, and, I have to talk them off the ledge. Like, no, it's okay. Like, I can manage that. You're okay. Because I think that, honestly, we have to talk about physician burden, too, or provider burden, right? So, we often talk about pill burden, where patients are taking so many different medications, and we're, as primary care providers, we're trying to, at least myself, I'm trying to take patients off of some of these medications and some of these supplements that I'm learning that patients just love to take a supplement, and yeah, I just like, anyways, but that's another conversation. But anyways, there's such thing as like physician or provider burden, where it's just like you have 5 different doctors for something that could be managed by 2 or 3. And that can be challenging. Communication is challenging because theoretically or ideally, your primary care provider will be the one to kind of bring everything together. So that way the patient knows, what this doctor is doing, and we're making sure that that medication prescribed by that doctor is not necessarily negatively affecting this particular part of your body, or, your sleep or stuff like that. But when you get into having 5 and 6 doctors, it can be very challenging, not only for the provider, but even for the patient. You have to go to so many different visits. That's a lot of co-pays as well. And sometimes not necessary. Sometimes it is. Absolutely. There are plenty of situations where it is, but that's a great conversation to have with your doctor too. Hey, I'm seeing this doctor. Is it necessary? Do I need to keep seeing that doctor? Is that something that I what should I do? And I have patients talk to me about that all the time, and we come up with plans together. So I
I
think
love
that
that. And you think about that, and it made me think about my mom, who has cared for a lot of her siblings, and they all each had, several. I think it's only one now, but several different doctors for several different things, and so she's running around the entire Metroplex, taking, from one visit to another, and it is a strain on the patient and the caregivers as well.
for sure. And it can be dangerous too, right? Like, things sometimes get missed. Medications get started without really finishing the other medication, and the communication aspect can be really, really challenging. So, oftentimes communication with fewer people can make that type of conversation or dialogue just easier versus having to set different, I guess, communication levels, if you will, with so many different providers. It can just be dangerous sometimes.
I 100% agree. That makes complete sense. Thanks for bringing that up too. So every doctor needs to know what medication that you're taking with that physician, and how long, and the timing. So that's great to know. How about you, Dr. Ogechi? Hi.
Yeah, no, I agree with, everything Dr. Newsome said. It's important. So your primary care is kind of like your first line of defense. You don't necessarily
Mm,
need to have like 10 different specialists, because your primary care provider coordinates all the care at the end of the day, and everything needs to still feed down to that primary care provider, because they're the ones that are going to manage everything at the end of the day. So even if you are seeing those specialists, your primary care provider still needs to know, because they need to be involved in the overall care that you are getting. So yeah, absolutely. You don't necessarily need a specialist for every single problem that you have. A lot of things that we can manage, but if it becomes too difficult for us to handle, yeah, we'll refer you out. But that should be somewhat in the discretion of the primary care provider. Do they feel comfortable enough handling whatever the issue is? And if not, then yes, they can refer you out.
So two things you made me think about. Your responses, both your responses made me think about. One is communication, right? And I know at one point in time you had to get on the doctor's, calendar and wait to the doctor. And I know with my my primary care physician, I can send a message, via the portal and get a response back. I'm sure Vince's Healthcare has something similar about that. So can you speak a little bit about, what time? What's a good time to message? Just send a message, or what time is it time to say, "Hey, I need to come in"?
I think it's always appropriate to at least call or message, because we're always checking our messages. We're always checking our, people call and leave us messages. They're called phone notes. So if somebody is calling, we're going to get that message that day, and we're looking through them all the time. So if it's something that is urgent, we'll get on top of that and we'll say, no, this person needs to be seen. Mm-hmm. If it's something that can wait, it's something that maybe we can call the patient later, or we can send them a message through the portal. But I think it's always probably safest to call and speak to somebody, because if you're concerned about something, you need to have somebody else's opinion, because you don't always have all the answers yourself or all of the information. So let somebody else that is within the medical facility take that question on, and then pass it on to the provider, or answer that question themselves.
That's a great point, and made me think too about a lot of medical providers have like a 24-hour nurses line as well that people can utilize, and some urgent care as well. So I think there are a lot of less intimidating, or sometimes approaches to trying to get at least some immediate feedback if needed. How about you, Dr. Newsome?
I think I agree. I mean, I think sending a message or making a phone call is sometimes or can be very, very helpful and instrumental. I know one of my primary goals with my patients, whether they're older or younger, is to try to keep them out of emergency rooms and keep them out of urgent care. If we can, sometimes it's inevitable, and the most appropriate place for you to go is one of those two locations. But, sometimes a simple message can prevent that. And, as we know that those two locations, as viable as they are and as instrumental as they are, they can have long wait times. You know, sometimes depending on insurance, can be very expensive, and you know, can be intimidating in and of themselves.
Yeah.
So, you know, we're here as your provider and your primary care provider to help, you know, ease that transition and hopefully keep you from ending up in those locations if possible. So sending us a message or a phone message, and then, you know, just being mindful that, you know, if we don't get back to you that particular day, that it doesn't mean we've forgotten about you. It doesn't mean that, you know, we don't care. It just means that, you know, you have to remember we have lots and lots of patients that are sending lots and lots of messages and going through a lot of different things. And sometimes it can be difficult to be able to respond in the most, I guess, the quickest way and whatnot. But nonetheless, like she was saying, we do check those messages, and somebody's always looking at them, even if we're not the first ones to see them. Somebody's looking at them and triaging to see what's the necessary and the most appropriate next step is.
I love that. And I'm thinking about my urgent care visits are typically, I feel in hurt myself, so I'm very clumsy. So, you know, maybe there's something I need to check out too. I've always been clumsy. So typically mine are around injuries that I have had in my house. The bathroom is a very dangerous place. So let me just say that. The bathroom.
It can be.
It's very dangerous. It's slippery. You're trying to shake. It's a lot happening.
Tight area. This is true.
But one of the things you kind of made me think about was, you know, being a doctor, having all these patients. Can y'all talk a little bit about how you are personally manage your own life work balance, and your own health, in balancing being, you know, both a physician on call, you know, people want a lot of access to you, and then also making sure that you have time for yourself to decompress and to manage your own life as well.
Yeah, I can speak on that, I guess. I think our rigorous training over the years and years has taught us, like, hopefully coping skills, you know, so you kind of find who your people you can vent to, your support systems. You know, I know that medical school, if nothing else, definitely taught me who those people are, what they're good for, what type of information they can handle, what type of information or support they can provide. And sometimes it changes as you get older, you have different needs. I think overall, just having that support system, whomever that may be, whether it's 7 people or 2 people, I know that's very, very instrumental for me. They're often my therapist as well, to kind of help me get through those tough days, you know, being a physician, because we can have tough days too. You know, we are human, and oftentimes patients, they forget that we, you know, we bleed like everybody else, and we have emotions as well. And you know, sometimes it doesn't seem like that being the provider or the physician, but it is true. And then in terms of health overall, I know I always try to hold myself accountable, because I tell patients all the time, you got to see your doctor. You got to see your doctor at least once or twice a year, you know, depending on your age and whatnot. And I'm like, I tell myself, like, you got to see your doctor. Like, go to see your doctor. I know you're a doctor. Like, I can manage most things that I have going on, whether it's like a cold or, you know, the flu or something like that. Like, I know what to do type of thing. But, you know, the basics and stuff, I do sometimes, you know, I have to be honest, do forget to kind of, okay, it's been a couple of years, about that time. And it can be challenging too. So, but I try to, like I said, the support system, and then just having those same talks that I have with patients day in and day out with myself.
That is so true. I can imagine. It can be hard to be like, no, wait, I might need a second set of eyes and ears to manage my health as well. And I think too, thinking about not having that burden or feeling like you need to, you know, do it all on your own. I know it's kind of my approach as well. How about you, Dr. Anyaoku?
Yeah, so definitely having those few people that I said, having those few people that you know that you can go to. And then for me, definitely I have to be doing some sort of physical activity every day. That's kind of like my mental and just physical and emotional therapy. So I work out most days of the week, and then also having a spiritual life and having devotion time with my Bible. So that's what I do.
I love that. And I've been into yoga and physical fitness around times where it was like time for summer, going to high exercise. But this past November, I began to really try to start running. And I'm not a runner. I hated running growing up. But what I have realized, it has been so healing for me mentally. Just getting out in nature, being outside. I love outside. I'm not a gym person. But it has really begun to kind of shift. I've fallen in love with it. So I think I can totally relate to being outside. Is there any one of you or both of you, do you all prescribe things other than necessary prescriptions to your patients to help them take their health to the next level, to improve their health?
So do you mean like
For
supplements?
example,
Okay,
great question. So for
sorry.
example, there's this program I've heard before called Parks RX. And what they sometimes prescribe, it's needed. There's some physicians in this network, and if they think that a local park, or walking your dog, or going for a walk a couple times a week will help with X, Y, and Z, or including a different food into your real food into the diet will help with X, Y, and Z. Are there any examples like that you feel you have done, or open to doing? Yeah, thank you. Parks
Well,
RX and Produce RX too. I didn't know there was a Produce RX. That's a common in the.
oh, I personally have never heard of those, but those are really interesting. I sometimes I know I think this kind of fits into what you're asking, but like for constipation, for me, okay, let me back up. So I like the idea of trying to avoid medication as much as possible, and using that as a last resort in situations where that's appropriate. And so I try to tell patients that too, because oftentimes, number one, we're physicians or providers, and so we're trained to, you have a problem, take a medication. Like that's what people think, and that's sometimes the case. But I try to, over the years, just step back and just say, okay, well, how can we do without a medication, because once we start a medication, then I have to manage that, and there's so much work that I have to do. There's so much work the patient has to do with their compliance and adherence and all that stuff. So if we can avoid that, I'd love to do that. I counsel patients all the time on like, if they have a dog, and they can utilize the dog to kind of help them with their exercise routine. You have to walk your dog every day. What's to say you can't make it a light jog versus a slow walk, just to kind of increase your metabolism and increase the burn calories for that particular day or activity, if you will. Another one is just, I tell patients, especially patients that are like, have like anxiety or issues with anxiety or even depression, or,
Heavy on
um,
anxiety.
right. I tell them, you have to take at least 30 minutes a day if you can, just to yourself, just like whether it's meditation, whether it's, quiet time, you're turning the phone off or leaving the phone in the house or whatever, and just taking some me time. I've had patients in school specifically. I remember a patient who was like, his blood pressure was high. He felt terrible. He wasn't sleeping. And it's because he was so focused on the task at hand, completing his degree, that he just wasn't taking me time. And I counseled him on that extensively. And, he started to implement that. And then literally I saw him, a couple months later, and he was like, Doc, I took your advice and I'm feeling so much better. I'm sleeping now. No medication, no
Wow.
medication whatsoever.
Wow.
He was like, I've taken the time that you talked about, and like I literally felt 100 times better. And I was, I think it surprised him. I was pleasantly surprised as well, and sometimes medication is not always the answer, not always necessary. I know and then kind of shifting gears, for constipation specifically, I like to tell patients or counsel patients that they can drink like hot green tea. That helps move the bowels, doing hot green tea once or twice a day. And it's not
I love
obviously a
hot.
medication per se.
Yep.
That can be helpful, or even prune juice is another one that most older patients usually enjoy.
Granny always had the prune juice.
Exactly, yeah. So little things like that, if I can avoid prescribing a medication, I will. Sometimes it's inevitable, and I have to tell patients, you want to take another 3 months, but I just don't think your cholesterol is going to get where we need it to go. But I'm open and willing, if you are. But sometimes it's just the situation that it is. But ultimately, I think no medication sometimes can be better if
Yeah.
it's appropriate.
I love that. I love that. So Dr. Lifestyle Medicines, what's your new name?
That's giving me a lot of credit.
No, not you. That's for Dr. Ogechi.
Oh, okay, gotcha.
Said earlier. That's her approach.
Oh, yeah.
So what are your thoughts around, so there were a couple comments and I'll let you answer. So in DC, there's a thing called Produce RX, and your physician can prescribe fresh fruits and vegetables, and you can get a voucher to shop at your farmer's market. It's a very cool program. Thanks for saying that, Michelle. And then Terren said Prince George's County is piloting a food as a medicine program similar to Produce RX. That's amazing. All right. So what are your thoughts around that?
Who is that for?
That's for Dr. Ogechi. Is she there? I see her. Dr. Ogechi? Can you hear me?
Hi. Yeah, now I can hear you. The connection was kind of going in and out there.
Okay.
I didn't hear the last thing that was said. Did you ask me a question?
Yeah, I was asking you about, do you prescribe anything that's not necessarily medicine to, or, a prescription to your patients? We was talking about, there are a couple of programs that Parks RX and Produce RX, where physicians are prescribing Parks as medicine and then come back and see how you're doing. And then the other program is a new program out of DC that said Produce RX, where they prescribe fresh produce and you get a voucher to your farmer's market to use that program. And Prince George's County is piloting and looking to pilot a similar program.
Right, yes. I am aware of Parks RX, and I actually was at a conference when it was first coming out in the area. And so, yeah, it's a really cool program. I actually do prescribe quite a few different things. So I do have a bit of a functional medicine, integrative medicine background as well. So I do a lot of, again, lifestyle medicine. So prescribing certain types of foods, like, certain types of patients, I'll push them more towards like a plant-based diet. And then we'll have like specific plans, and then specific, amounts of exercise I'll do in a given week. And then meditation programs, sleep, prescribing, a certain amount of sleep every night and kind of working them back on a consistent basis. And then in terms of like certain supplements, like I said, I do have a bit of a functional medicine type background.
Uh-oh, she's breaking up. We heard the gist of it though. All right, so I think that's amazing though, and I think a lot of times our community feel like it have to be one or the other, but there are opportunities I feel for integrated health, right, and to getting to the root causes. Are you back, Dr. Ogechi?
Right now, yeah. I was saying, in terms of like supplements and things, there are sometimes I will recommend, like for somebody who, they tend to be a little bit more inflamed, I might say add some more turmeric in your diet, or like Dr. Newsome talked about, green tea for patients who, if they're wanting like a clean energy or a little bit help with weight loss and a boost like that. And there are other herbal type supplements that can help just kind of with like hormonal balance, anxiety and stress and things like that. So sometimes I might mention those things, but it's more so, like I said, really trying to manage the lifestyle and implementing good, healthy habits.
I love that, because I think that kind of addresses the root cause of a lot of the issues versus just a passing, put a bandage on, the effects of bad diet. I know a lot of times, and I am in the plant-based journey myself, and I have been for the last couple of years. And I'm from Texas, originally from Dallas, Texas, and we don't consider a meal unless there's at least one meat there. So to say that this is a whole mindset challenge is it's extreme undertaking. I never thought that vegan would be in my vocabulary, something that I identify with. But that said, I think a lot of times people don't necessarily understand the benefit of increased produce, fresh fruits in our community. It's kind of, there's people who are healthy that kind of automatically get it, but I don't think there's a widespread understanding how we can get back, because I think we're just one generation removed where we were living off the land, and we were living, I remember most of my grandparents had, some kind of patch or garden or fruits and vegetables in the backyard. And so we've known growing food, or, a neighbor grew food and we ate from there. And now we've gotten away from that. But can we talk a little bit about the benefits of, more fruits and natural foods and vegetables in our diet, and how that begins to affect some of these diabetes, high blood pressure, high cholesterol, some of the things that we know are plaguing our community?
So I didn't catch everything that you said. It was going in and out, but I think I got the gist of what you were saying. One simple thing that I like to tell most of my patients is, and that can really have a huge impact on their life and if they're battling any of these illnesses, eat the rainbow every day. So eat one color of the rainbow from either a fruit or vegetable every day. So if it's red, if you just go down the spectrum of the rainbow, red. If it's an apple or strawberry, a raspberry, whatever, something that's red, something that's orange, yellow, whether it's corn, yellow squash, something from each color every single day, and you can have such a huge impact, not only just with increasing your fiber intake, with decreasing inflammation in your body and improving how your overall feel. And it can just really be very, very beneficial. So that's like one simple thing that I love to tell my patients, because not only does it help to reduce diabetes risk and just management of diabetes, it also helps to lower your blood pressure.
I love that. Great. How about you, Dr. Newsome?
I usually go based off of like patients' lab results and things of nature. So if they're having difficulty with high cholesterol, or even on the border and things of that nature, or even low vitamin D, I try to counsel the patient specifically on, different foods that can help implement or either decrease the cholesterol or even increase, vitamins like vitamin D and whatnot, or even calcium and things of that nature. So I'll even like write out lists of, some of the foods that can be really, really helpful. But fruits and vegetables for sure. I usually try to encourage patients to get them in at least 2 meals of the day, a fruit and a vegetable, and at least 2 meals, like I mentioned, to try to help implement those dietary changes. That's one of the questions I actually ask patients during their physicals, like how much fruits and vegetables do they eat on a daily basis? And then
Basis.
exactly. So, if nothing else, hopefully that encourages them to say, oh, wow, like my doctor asked me about that. Like, I really need to do better, because it highlights that there's a deficit,
Right.
and a lot of people have deficits in that regard. Even before we get to the blood pressure, the labs and all that stuff, just, noticing, how often are you eating out? If you're buying most of your food from restaurants and things of that nature. And granted, there are some good choices, and I counsel patients on that too. There's a lot of, what's it called? It's like salad restaurants, like Sweet Greens, and they're not paying me. I'm just saying, like, those are some of the restaurants that I try to lean towards in my own daily living and whatnot. So those things can be really instrumental and really helpful. And then you got to be careful. Sometimes I also have to counsel patients. There's some patients, especially Hispanic patients, they usually I think they have a lot of fruits in their diet sometimes, but if they're diabetic and they're having difficulty with keeping their blood sugar under control, we sometimes have to scale back on some of the fruits. Vegetables are usually pretty safe as long as you're cooking them appropriately, and we talk about that as well. But the fruits can be a little tricky if you're not careful. So those are conversations that I often have with patients depending on their health issues.
I love that. I love that. I love that. And you know, yeah, we talk about meat. I think a lot of times we think as it has to be cold turkey, or you have to be vegan. But I met this gentleman, young white guy, some years back that had wrote this book called Reducitarian, and he basically said, can you reduce meat, from one meal a day, a couple times. I think he said a couple times a week at first, to a day, and just kind of begin to reduce your meat intake and the benefits that it have on your body, and then also the benefits it has on the environment as well, which is a whole nother story. But I think, it's kind of good to kind of talk about, when we talk about lifestyle, that it doesn't have to be an instant overnight thing. It is gradual. I think I'm thinking about my journey where I was like, I just want to not feel completely sluggish and bloated and heavy and lethargic, every day in, day out. And what needs to happen for that begin to change. So I was basically fed up with, how I was feeling. And it became normalized, that, this is just the way it is. When it's like, no, it doesn't, I don't think this is how it has to be. And what steps can I begin to make? And then, I'm on this lifelong quest now. So I think a lot of people are I think if we can break it down to say, hey, what's one or two steps? So that could be the question we're asking, and we'll do some Q&A. I see one question in the Q&A, and that'll be, what's one step you feel someone can take today to improve their health?
Let's see. So I would say to the person that, let's say, doesn't exercise, doesn't really follow any strict diet, and it's just like, yeah, I just want to get healthy. Because sometimes there are patients like that. Often they're just like, I just want to do something to be healthier tomorrow than I was today. I would tell that patient to go out and, take a light jog or a brisk walk once a week. I would say just start off with once a week, and then eventually work your way up and set goals where, every week you're adding a day or adding like 10 to 15 minutes to that walk or that brisk walk or jog. And before you know it, your stamina is going to be so elevated. You're going to feel so much better. You're going to be more energetic. Your mood is going to be improved on a daily basis. So that's what I would say. I would say go outside and walk or do like a light jog. And it doesn't have to be forever, maybe like 15 minutes. And then set goals for yourself, right? Like
Right.
more days of the week as well as the longer duration. So that's one thing that you can do. And again, it's only once a week in the beginning. So
I love that. I love that. So go walking once a week for 15 minutes is a step that everyone can take. Most, people can take. So to take that step. All right. Dr. Ogechi, is she there? I see a circle around you. So
Yeah.
there you go.
So I'm gonna go. Uh-oh. Can you hear me? Am I there now?
I can. Yeah, we can hear you now.
Is it working now? Okay.
A little bit.
I'm gonna go back to the food because I'm always gonna go back to the food. So I would say add a veg every meal. So if you like to eat eggs in the morning, throw some spinach and make like a spinach and egg omelet. If you eat lunch, have like a salad. If it's dinner, throw some steamed broccoli in there or some spinach or something, but add in a vegetable at every single meal.
I love that. That is so perfect. So we got a little food that we can begin to add a vegetable into every meal. And then we're going to set goals for getting outside and walking and jogging. That kind of helps with endorphins and also for physical wellness as well. I think that is really great. All right, so let me get to this question really quick. How should we approach screenings for certain diseases or illnesses that may run in our bloodlines? Again, you kind of touched on that, but are there anything that you feel like at 30 or 35 that, these are the screenings you should definitely be having, or, at 40, you feel like we should have these screenings?
I'll let Dr. Ogechi take that one.
I think a lot of At 30, it depends on your family history. So, like, if you do have a family history of any sort of gastrointestinal cancer, you're going to want to start screening earlier around that time. If you're a woman, you're going to want to do your cervical cancer screening starting earlier at age 21 if you're sexually active. And of course, guidelines are kind of always changing here and there. So we talked about the colorectal cancer screening that's now 45 instead of 50. So it does kind of change a little bit based on your family history. So it's always important to tell your doctor what your family history is, and then they can determine what screenings you're going to need at whatever age. And they should tell you, like, okay, you're going to need this now, you're going to need this in the next 5 years, and you're going to need this at that time. So
awesome. You have anything to add there, Dr. Newsome?
Uh, no, I mean, I think that she touched on it. Having open dialogue, especially for women, in terms of like mammograms and breast cancer screening, as well as cervical cancer screening or Pap smears and whatnot. Those things do occur at a younger age, like she was mentioning. Guys are a little bit easier as long as there's no significant family history. At least at the age of like 30 and things of that nature. But 45 is big. Prostate cancer screening is another big one, especially for minority men, where, I typically start to screen them a little bit earlier than, what's recommended just because the prevalence is so much higher in minority men and whatnot. So nonetheless, those are some of the conversations that can be had or should be had. And it kind of, the family history does play a role. That's one of the questions I usually ask all my typically minority men patients or men patients in general, any family history of prostate cancer, because 55 is usually when, at least insurance, I think, recommends 55 in terms of prostate cancer screening.
That's really late. Yeah.
Yeah, that could be a little late for somebody with a positive family history. So just knowing that information, and to be honest, sometimes it can be challenging to even know. Sometimes patients don't know the difference between prostate and your colon and whatnot, and I get it. Like it's challenging. Some of those things I didn't know before, starting on my medical journey and whatnot. So having those questions, and sometimes it's challenging as well, right? Like you don't know what you don't know.
Yeah.
But posing open-ended questions like we mentioned earlier, just like, is there any screenings I need to be worried about? Anything that I should or should not be doing earlier or later, just posing those questions. And that's why it's important to have a primary care doctor that you feel comfortable with, so that way they can inform you of those things, even if it's not that particular day, but knowing what's to come in years to come. So my
and
women
I think
patients,
too, kind of walking through. Yeah, I think kind of too, like walking through what that is, because I've heard about colonoscopies, but I haven't experienced it yet. But it doesn't seem fun. But sometimes, the knowledge is power to kind of say, okay, to ease some of the fear and anxiety around it, like what's going to happen, during that process. One of the things too you mentioned, Dr. Newsome, was something about when you're looking at blood work, you're looking at vitamin. I think you said D's and dog, but I don't know if you said D's and dog or B's and boy. And
D's and dog.
D's and dog. And what effect does that have on our health, wellness?
Oh, for sure. So vitamin D is really important for bone strength. Women specifically are at increased risk for osteoporosis just because after they go through menopause, their bones tend to weaken significantly. And so knowing, your vitamin D levels at earlier ages and basically taking supplements if necessary can be helpful. There are some situations where men can have weakened bones, depending on some other health conditions that they have. So it's often nice to know if their levels are a little if their levels are a little bit low, and requiring supplements, because it's challenging. Our non-minority patients, may or may not be able to. I mean, honestly, anybody. Like it's challenging to get enough sunlight and safe sunlight, to be able to get the levels of vitamin D that you need. And then oftentimes patients don't even know what foods are high in vitamin D besides like milk and dairy and things of that nature. And then those can be challenging as well if a patient has high cholesterol. So like, those sometimes supplements are the only way to go, and, checking those levels can be helpful, and then receiving that counsel as well is good. But bone strength is what vitamin D is good for and very important for.
Awesome. And that's great. That's great that you're monitoring that as part of it. I don't think I've had that test. It might have been, but it's nothing that I've seen communicated or seen on any lab work. So that's something even now I can kind of check in on. So the question was supposed to be, what about dehydration? And she says, my bad. How does dehydration show? How does that show up? So I guess the question you're asking, Michelle, how do we make sure that we're hydrated, or how important it is? I'm not sure what the question is. Yes, no.
So, dehydration can show up in a lot of different ways.
Okay.
One of the ways that we can kind of quickly tell, and we don't even think about it sometimes, is if you're having frequent headaches.
Mm.
And yeah, if sometimes people will feel like you have a dry mouth. But I think oftentimes it comes about with headache, or if you're feeling very fatigued or just not feeling well, sometimes it can just be that you're not very well hydrated. And then, of course, when we do our lab work, we can tell whether or not I've been very well hydrated or not. And even looking in your urine, if your urine is dark
Yeah.
yellow, you're probably not drinking enough water. It really should be a very pale yellow, and that's how you know that you're well hydrated.
I
And
love
then
that.
I
That's
would
such
say
an
that
easy test.
a good goal, yeah, a good goal that, is a generalized goal for people is kind of somewhere close to half your body weight in ounces. So if you are somebody who is 100 pounds, you should be drinking somewhere between 40 and 50 ounces of water a day.
Awesome. That's a great guideline. I think it helps with so much of our body functions that we probably take it for granted. The work that the water does in our bodies. Anything else you want to add there, Dr. Newsome?
No, I think those are great. I mean, if you're always finding yourself to be thirsty, chances are you might be a little dehydrated, for obvious reasons. Being mindful of how much water you're even losing. If you're going to the gym and working out and running for like 45 minutes on the treadmill and sweating excessive amount, you might need a little bit extra boost of water intake or fluid intake to kind of make sure that you're staying well hydrated. Monitoring your urine is a huge, huge component. It can be very telling of how well hydrated you are. And all, I guess, liquids aren't created equally either. You're not getting well hydrated from caffeinated drinks like coffee. That's usually going to make you more dehydrated. You have to keep that in mind when you're trying to replenish your fluids, as well as sodas and other sugary beverages. So all those things can kind of tip the scale in one direction or the other as it pertains to your hydration levels.
I love that. I love that. I love that. This has been so informative. So I thank you both for making so much time. And I think for me, one of the goals we had for this conversation is really just kind of take the fear of managing people's health out of, or reduce the fear around managing your health. And I think moving forward, like, how can we be more empowered in our owning our health is really one of the goals that we had. So any closing thoughts that you have that you want to share with our community, and then also let us know how, I'm sure you got some new patients that want, at least some people that want to get on your wait list, how people can find you in the area, like what areas do you serve?
So I work in the White Oak, Maryland area, which is like a community in Silver Spring, Maryland. I work for Adventist Medical Group.
Way out.
I guess it's all relative. But yeah, so that's where I work. Adventist has, I mean, our office pretty much houses all phone calls and things of that nature. If somebody wanted to get on my appointment schedule, you could just call the office. The phone number is 240-637-7000. That's just our particular office. And then online, you can always make appointments online as well, going to the Adventist Medical Group website or even just Googling Adventist Medical Group. We have like a little search engine where you can search for a physician. If you just type in my last name, that would be good way to kind of pull me up. I do not work at Fort Washington anymore. I think that's somewhere out there still, but I am now in Silver Spring at the White Oak office.
Okay, awesome. I believe Dr. Ogechi works at the Fort Washington office.
She does.
She does. She's breaking up. Okay, so she comes in. What I can say is that my experience working, coming in as a partner, community partner for Adventist has been amazing. And we're working on an event this week for Juneteenth around wellness as well. And the Fort Washington office has been all hands on deck.
Awesome.
This amazing support system. So I really am grateful for them, believing in this vision and really, rolling up the sleeves and saying, hey, let's get this done and let's do it for our community in a way that really matters, and not just to say we did it, just to say we did it, if that makes sense.
Absolutely. No, it does. That's great. That's amazing.
So I am excited about that. So Fort Washington for Dr. Adventist, okay, she completely got disconnected. Adventist Healthcare for Adventist Healthcare, Fort Washington Medical Center is how you can find Dr. Ogechi Anyaoku. And she's super dope as well. And I just want to thank you so much for your time and energy, for being with us. She's trying to get back in. Let's bring her back. Let's see if she's able to get back in. There she goes.
Yay, she's back.
I'm sorry, guys.
No problem. You know what?
Challenging.
Internet, it happens.
I think we're having some thunderstorms over.
It does look cloudy. It's like it's clouding up now. So anyway, I just want to say, how can they find you, Dr. Ogechi, and any closing thoughts for us?
So I am in the Fort Washington Medical Center. I believe it's the only outpatient center in Prince George's County. I know White Oak does serve Prince George's County, but it is the only one in Prince George's County. So you can find her at Adventist. And then, yeah, you can go to the Adventist website, and I'm on there as well.
Awesome.
I would say thoughts would be, again, just set goals.
How are we hearing the set? I heard set goals.
It's coming.
You and your provider are on the same page.
I love it. We heard same page and set goals. So that's what we're going to go with. And we won't keep you any longer. Feel free to reach out to them if you want to get on their I'm sure, waiting list. I feel the warmth and love, so I'm sure their patients love them. But it's so important to have great physicians. It's so good to see ourselves reflected in people who are doing medical care for our community. So we just congratulate you for doing the work, being supportive, and we wish you all the best in your journeys.
Thank you.
So thank y'all so much. So tomorrow we're picking right back up. We're talking about nutrition, which is a great segue because we talk about food a lot here. So tomorrow we are having Leslie Jefferson with Giant Food Store. She is a licensed nutrition. Again, we're bringing professionals who have done the work and study. So we're not listening to what our cousin, grandma, we've seen on Instagram. You know what I'm saying? We've seen it on a meme. We don't know if that's true. You know what I'm saying? So let's bring in professionals who have done the work to really bring in the right information so we can make better decisions for ourselves and our family. So we're doing Eating to Live Your Best Life tomorrow, and we're looking forward to that conversation as well. And then we have programs all week. Wednesday, we're doing meditations. We're doing 7 a.m. So everything we talked about here, we're doing. So we're good.
That's amazing. That's good.
Wednesday, we're doing meditation, 7 a.m. and 7 p.m. 7 a.m. with Michael Hatcher, and then 7 p.m. with Michelle Nelson. Thursday, we're talking about mind, body, and soul. We have our licensed marriage family therapist, Tariq Omari Walton, leading that conversation with Jay Hall. And Friday, we're doing yoga. Literally everything we talked about on this conversation is happening this week. And then Saturday, we outside with free screenings with Adventist Healthcare, Howard University Hospital, Prince George's County Department of Health, Prince George's County Parks and Rec. It's going to be a whole thing. So we see y'all outside. All right. If y'all have any questions, hit us up in the DMs, and we'll be happy to answer. Thank you so much. Y'all be blessed.
Thank you.
Have
Thank
a
you
great
for
one.
having us.
Thank you.
Thank you.
Bye.